The Care4Carers campaign is demanding that Life Healthcare stop paying shareholders until 2022. Life Healthcare includes Netcare and Mediclinic. Today, protesters gathered outside the company's headquarters saying it must prioritise the well-being of frontline workers. The Care4Carers campaign is an Oxfam initiative and supported by the Treatment Action Campaign. Let's get more from the TAC's Sibongile, Tshabalala. Thanks for your time. We appreciate it. First, take us through your concerns regarding frontline workers at the Life Healthcare Group. What are you hearing from employees?
Good afternoon. Firstly, what we hear is that frontline workers are supposed to work extra hours. They are supposed to give it all as frontline workers. And what is more problematic is that if they infected COVID at work, they have to take care of by themselves, even if it's not at work. But we know that they are frontline workers and they are at risk and they are in a high risk. So we are saying the Mediclinic, Healthcare Life, and Mediclinic, Healthcare Life and Mediclinic, they should make sure that they take care of frontline workers, irrespective of which sector are they in, whether they are in public or they are in private.
But what do you mean by take care? Because you must have some concerns for you to come out and say this.
Yes. Remember, ever since that we had challenges of COVID-19, most of the healthcare workers that were most of the people that were mostly affected by COVID-19 are healthcare workers, and healthcare workers have given us as a country a lot more. They have given us their lives. They have been working day in, day out, making sure that people are surviving, and they've been through hell during that time. So taking care of them, it's a minimum that we can give back to healthcare, to frontline workers, especially healthcare workers, which they showed dedication during the difficult time of the pandemic. As you just said earlier on the news, that it seems like the peak is going up again. Who else will be in the front line? We will need the very same frontline workers to give to communities and to support us as communities and to take care of us as communities. Therefore, as a Care4Carers campaign, that is why we are demanding that care workers, they should be taken care of. And we know that some of them, because of this minimum salary that they are getting, they are working day in, day out. So they are working in the public sector, they are working in the private sector. So they need to be taken care of because they are giving us their services. So we have to give the back as communities.
So you also want the group to stop shareholder payouts until 2022. Tell us why. Do you want that money channeled to frontline workers instead?
We want that money channeled to the testing of frontline workers, irrespective of whether they are from public or private sector. And we want that because the shareholders of these three companies, which is Netcare, Life Healthcare, and Mediclinic, they've been making so many billions. From 2016 to 2019 only, they managed to give their shareholders 19 billion, of which that doesn't talk only to the profit of 11 billion that they've made. So they are making so much money. Even during the pandemic, they were not doing testing, COVID testing for free. They were also receiving money, and they were charging monies from 1.6 to 900 rand to do a test, which is so high, and they have made so lot of money during this time. So they should also take care of the communities as private sector, and they should not stop to be greedy. Remember, at the end of the day, they need the very same communities, or they need the very same healthcare workers to be able to, for them to be able to carry on with their businesses. So that is why we are saying they should, at least from 2021 and 2022, that money should be going directed straight to healthcare workers support, especially those who have contracted COVID-19.
All right. Thank you so much for your time. We appreciate it. Sibongile, Tshabalala from the TAC.